It is not a new idea, but we need dental care for people with intellectual disability. It is necessary to have that. Dental clinics are provided for people with intellectual disability. Dental care is really important because if you have to go to the public dentist, you have to wait for a long time. It is important to get treatment straight away. If you need to get a tooth out or you have pain and you cannot wait for that long, dental um, dental health is important even if you just want to get a checkup. This is also important to stay healthy. We need to be able to go to the dentist. Going to a private dentist costs so much money. It is difficult to be able to afford it. It would be really good to have a dentist for myself and my needs. This would really help me and my friends and my community to get access to dental.
They're more patient and more respectful. Like when you go into hospital, they ask what treatment you're getting and who's the doctor you're seeing, and they'll say, "Oh, not too long for your appointment," and they usually like check your temperature or check if you've got COVID before you go in, and they're very polite. If you don't understand the form, they're like, "Oh, well, we can help you out with this form. If your parents can't help you, we can support you."
I guess one of them is for the country region. They go to the agriculture or the I forgot how to read it. Food days, that's the word I'm looking for. Agriculture food days. I remember in 1980s, I went to a food days and was a person there talking about your health, man health or woman health. And it was explaining what her, at this age, what you should look for. So I'm thinking with intellectual disability going to, because their parents were taking their child to on a food days, and I noted Victoria got a thing called farmer health checks at the food days. So I feel perhaps the intellectual disability can do the same thing next to them, under the same tent, and talk about health and what for intellectual disability, and work with a farmer, because farmers will have a nurse there. They can just check the blood pressure and do that. But we have a banner at the back to say what things need to be checked at that age, and give it to the person with intellectual disability to think about. And then hopefully they will go to a local GP and get check over, and they know their questions because already been written for them about that. That would be for the country people.
The telehealth helps. Yeah, telehealth really easy.